name is Alissa McDonald, and I'm going to be doing validation of making an occupied bed. My 7 steps are: first, review physician's orders; second, identify the patient; third, introduce myself; 4, explain the procedure; 5, gather my equipment; 6, wash my hands; 7, provide privacy. So here's my patient. I've transitioned and we just finished bed bath, so they're wearing a new gown. I'm now going to be explaining to them that we're going to be making their bed with new sheets. So first I'm going to be raising the head of the bed to my working height, making sure that the patient isn't lying in a flat position. This is a good working height for me, so I'm going to lower the guardrail. I'm going to be removing the pillow from the patient's head. Second, I'm going to be removing. I'm going to make sure that the patient is closest to me because we're going to be removing the sheets and everything, so I'm going to have them roll. So I'm going to ask the patient to cross their legs, bring this arm up, face that direction, cross their arm, and I'm going to ask them to hold the guardrail on the opposite side. If not, I would ask for assistance. So with good body mechanics, I'm going to bend at my knees, and on the count of 3, 1, 2, 3, hold the rail. And now I'm going to be removing the soiled linens. If the linens are really soiled, I'd be using gloves, but they're not, so we're okay. Once again, my patient's holding on, or I have assistance, so I'm okay to move. I'm continuing to remove the linens. I'm going to be rolling them underneath the patient, and now I'm going to be starting with my new clean linens. I'm going to be mindful to not have clean linens be touching dirty linens, and there's going to be a space in between. So we first start with the fitted sheet. Okay, again, border in between so clean and dirty aren't touching. Next would be the fitted sheet. I'm sorry, the draw sheet. Draw sheet would be next. I'm going to bring it close to the middle, but without touching those soiled linens. Next would be the chuck. Okay, so I have my linens, my clean linens up to this part. I'm going to raise this guardrail because the patient's going to be rolling back this way. I'm going to explain to the patient that I'm going to be coming around now to meet them. Or I'd be switching sides with somebody that was assisting me. I'm going to now have the patient roll onto their back for me. Okay, I'm going to release their arm from this guardrail. I'm going to ask them to roll onto their back. They're going to feel a little bump between clean and soiled linens. I'm going to remove this guardrail. I'm going to have them bring this arm down, cross this leg, raise this arm up, face this direction, and they're going to now roll onto that bump and hold this guardrail, or someone would be helping me. And now I'm going to remove these soiled linens. I would be placing them not on the floor, but on a chair, or if the only thing I had was their table, I'd be putting it on their table. And now I'm going to bring the clean draw sheet through, the clean fitted sheet through. So the fitted sheet is now on, new clean, and now I'm going to have the patient roll onto their back for me. 1, 2, 3. And I'm going to be making sure that the sheets are well within the center of their back. If not, I'm going to ask the patient to use their legs to scoot, pick their hips up, and we could pull them through a little bit. Make sure they're flat underneath them so that doesn't cause any discomfort. They can bring this arm down. Legs are flat, no discomfort underneath them, and everything is nice and smooth. Now we're going to be putting on the clean top sheet.
If it was all of them.
Okay, I'm going to be folding it down here across their chest, tucking it in.
Oh, wait, I thought it was me.
On this corner, I'd be making a miter corner, as well as over here. So we have a nice mitered corner here. And now I'm going to be making sure that the patient has some room to do dorsi and plantar flexion. But first and foremost, before I came to this side over here, I would have put this bed rail up, which I noticed I did not. So before moving to the work on that side, I would have put this guardrail up. So I'm on this side, I've made my mitered corner, I've tucked these sheets in. Okay, now what I'm going to be doing is I'm back on this side, I'm going to be lowering this guardrail so I can put the blanket back on. I'm going to be tucking it in for the patient, making them nice and comfortable. Last thing that I would be doing is donning a new pillowcase for their pillow. So I'm going to be removing this pillowcase, make sure not to shake anything. And when I do put the new pillowcase on the pillow, I'm not going to be shaking it out. I'm just going to be sliding the pillowcase little by little over the pillow. So I've done that. I will give the patient the new pillowcase, make sure their blanket's nice and sheets are in, everything's smooth, raise the guardrail, lower the bed to its lowest height, give the patient the call bell, ask them if they're comfortable, if they can do anything else for them. If not, document.